Health Watch, many people who contract COVID-19 can have lingering symptoms even if their infection is mild. Dr. Mallika Marshall joins me now. And doctor, it could take weeks or possibly months for you to feel back to normal.
Yeah, I know a number of patients who've gotten COVID and weeks later still aren't feeling great. So these were researchers in France that looked at 150 patients who were diagnosed with COVID-19 and found that 2/3 of those with non-critical disease, so these were not the sickest of patients, still had symptoms up to 2 months later, including things like loss of taste and smell, shortness of breath, and fatigue. So I really want this to be a reminder to people out there that for many people, getting coronavirus is not just like having the flu, and that the effects can be long-lasting and debilitating, even for people with what is considered mild illness.
Well, there's also some new research on wearing a mask, which debunks one common complaint that wearing a mask overexposes you to carbon dioxide and could possibly kill you. Doctor, this is a big debate among a lot of people.
Yeah, I hear from people with some frequency, oh, if you wear a mask, you're going to pass out, it's really bad for you. Not true. This was a study in the Annals of the American Thoracic Society, and they looked at changes in oxygen and carbon dioxide in healthy individuals and veterans with COPD, which is a common form of lung disease, both before and after wearing surgical masks. And they found that the effect was minimal, even in people with the most severe lung dysfunction. So, you know, it's true that many of us might feel winded when we've been wearing a mask for a while, but they say that that is more typical during periods of exertion, like when you're walking upstairs or you're jogging, and that you can simply take off your mask if it's safe to do so, or slow your pace down. But you should not use the excuse of, oh, if I wear a mask, it's going to make me sick, as a reason not to wear one, because in fact, it's going to actually help protect your health, as well as we know the health of the people around us.
And it's so simple to do. Dr. Mallika, thank you as always for your insight.